Hello viewers, welcome to the channel on emotional well-being. I'm Rashmi Malapur Jaswal and I've been running these series on YouTube about how we can live an emotionally healthy life. In few of our discussions with Mr. Anthony Colaco, we spoke about how it's necessary to sit in silence and connect to your breath. Now we go a step further and we talk about how what will happen when you connect to your breath. Today we have Dr. Alpa Dalal with us, and let me first introduce her. Dr. Alpa Dalal is the head of Department of Pulmonary Medicine at Jupiter Hospital, and she's a certified Kriya Yoga teacher. Takes a holistic approach towards patient rehabilitation through a meditation program at Jupiter Hospital for the past 7 years. She has 15 publications in her national and international journals and more than 100 citations for her research. She has done pioneering work in the field of tuberculosis and yoga for respiratory diseases. As co founder and the driving force at HealthBank, she conducts corporate workshops, sound therapy. I think the behind those bars, I think so, are for the sound therapy. Let us talk about that also later. Sound therapy sessions and learning sessions on varied topics online. Uh, Welcome, Dr. Alpa Dalal.
Thank you. It's a pleasure being here with you and your viewers, Rashmi.
Yeah.
Be
Thank
happy to share my experience and insight on this subject. It's a
Yeah,
wonderful initiative. Let me congratulate for taking up this initiative.
yeah. Thank you so much. It's an honor and a pleasure to have you on our show, and I'm sure our viewers will benefit from it. Thank you so much. So let's start with we spoke about health bank and sound therapy. So would you like to share from where this entire concept emerged and what is this concept all about?
Yes. So, see, basically, I'm a doctor. I'm a practicing pulmonologist, so chest specialist, and
Okay.
I'm into practice for past 27 years.
Okay, great.
Being a pulmonologist, we all see patients at the other end of the health, when
Yeah.
they really have health issues and health problems or so-called health scare, then they come to us and we fix the problem. And it so happened that as our practices grow, we get so busy practicing health problem or fixing the health problems that nobody really has time to look at health. And I always used to dream that health industry should not be health scare, it should be really health care.
Absolutely.
Uh, Health, I mean, when you talk of bank, it's about saving, it's about safety, security, it's something that you can depend on in the time of crisis. And it's something that you invest in such a way that your money multiplies and then you can enjoy your investment. So do we do same thing about our health? No, we really don't. The only health investment that we probably do is maybe, pay our insurance premium, the health insurance premium. But how do we know, or do we have any guidance or kind of, attitude towards investing our time, money, and energy into health per se, so that we never end up in health crisis? I see a lot of people, I mean, that's my profession. So I see a lot of people, they spend money after health meaning after their health is spoiled. But very few people actually spend money or energy for health. So this is what was the basic concept why we wanted to start HealthBank. So I was very fortunate in my life to have suffered some health issue, which made me realize that I should be focusing on prevention for myself. And then I happened to meet my masters, Dr. Premji Nirmal and Guruma Bharti Nirmal, from whom I learned Kriya Yoga and meditation. And I started doing it for my patients. So after having this experience for 2-3 years, my sisters, both of them are architect, Sejal Khan and Purvi Dalal. So they also joined me. They also learned from my master. And then we felt that there is a need to start something formal so that we can help people to make them aware about what is what is it all about investing in their health, and not only make them aware, but actually help them with hand holding to implement all these things to work upon their health. And from there, the concept of HealthBank started, and formally we founded HealthBank in 2014.
Okay. Okay.
So this is all is the concept. And let me tell you that I've been treating patients for so many years, and I've got a good name and success in my field, but I've never got so much of satisfaction that I have got today by helping my patient to transform themselves.
Yeah, I'm sure. I'm sure it's very self-satisfying, and fulfilling as well to really guide people on this path. I'm sure.
Absolutely.
Yes, yes. To go further, how is our breath connected to our emotions? Is it really connected to our emotions?
Yes. So this is a very interesting, concept. This has always been described in our scriptures, in all our yoga books or yoga scripture. This has been described. And when I became a pulmonologist and I studied the physiology of respiratory system, this is actually scientifically true. You see, a breath, when you talk of a breathing process, it's
Mm-hmm.
a unique system in our body which has
Okay.
dual control. So what do you mean by dual control? It's something which is voluntary and something which is involuntary. Say, for example, you when you sleep in the night, you are not consciously doing anything about your breathing. When you are walking through the day, you are occupied, your conscious brain is occupied doing something else, but your breathing continues. So that involuntary control is in the lower part of the brain. It is called lower brain center. So that makes you, continue your breathing process. But there is also another center, which is called a higher center, which is on the cortex of your brain. And that center, which has a voluntary control over your breathing. And
Okay.
that higher center is closely linked to the limbic system, which is governed by our emotion.
Okay.
So whenever we get emotionally disturbed, the limbic system sends signals to this higher center, and this higher center will in fact have the impact on the breathing. And that's why we see when people get angry, they start to breathe very fast. When people are agitated, anxious, they start to breathe very fast. And then when they are, settled in happy mood, they breathe very evenly. So many times we get patients, they come with a panic attack and they're breathing so fast, and we check and every other parameter is kind of normal, and then we send when we calm them down, or sometimes we have to give them even sedatives to calm them down, and then the respiratory breath, the breathing system settles down. So there is a very, very close link between your emotions and your breathing system or your respiratory system. And in fact, there have been so many studies. So there have been a very good study where they found that people with certain kind of emotions had certain brain patterns and certain breathing patterns. Okay, so they correlated the breathing pattern, the emotions, and MRI images, which showed certain areas of the brain that were getting lit. So then they did a reverse study where they did, people were not emotionally disturbed, but they asked them to do those kind of breathing patterns.
Okay.
They found in the MRI exactly the same areas got activated, which got activated with those emotions. So
Okay.
that's how strong the link is between your emotions and your breath.
Yeah, I mean, this is amazing that even research has, kind of endorsed this theory, and it's not only about just a belief, but it's proper science. So
Yes.
yeah, that's really amazing, and I'm sure our viewers who are listening, they're going to, start thinking very soon about their health also.
Yeah, so I would just like to add here a
Yeah.
point that, why are we, or why should we be interested in knowing this concept? Because all of us know that it's so difficult to control our emotion, especially when you're gripped by emotions, say like fear or stress or anxiety. That time, if somebody gives you a suggestion, you'll not even be amenable to the suggestion. So how does this link help us?
Yes.
That is a very well known fact that it's very difficult to control the mind. It's very difficult to control the emotion. but it is possible to control your breath. Okay. Just as a voluntary exercise, also, it is possible to control the breath. So, all the yoga practices or even the modern breathing practices focus on this fact that it is possible to control your breath. It's not possible to control your emotion. And then you can find a bridge or a roadway to your emotion
Absolutely.
through the breath.
Yes, absolutely. So, so is it possible for us to focus on our breathing and then modulate our emotion? That's what you're trying to say here.
Yes, yes. So that's what I was trying to say, that it's possible to modulate your breath to be able to access to your emotion. In fact, and being a doctor, I was so blessed to be in a position where I could see the best or worst of both the worlds. So
Yes,
I used to get patients. So I would have patients who would have, conditions like asthma or COPD,
absolutely.
advanced stage
Yes.
of asthma or lung fibrosis. And, these patients, when they're in advanced stage of the disease, they are always breathing at a faster rate and they are so
Yes.
anxious, and more faster they breathe, more anxious they would be, and then that anxiety would have add upon their problems, and they would have more exacerbation of symptom. And
Mm-hmm.
realize that medication has a limitation. To a certain extent, I can give them medication to control their self. But if I give them medication to calm them down or to reduce the breathing, to reduce the anxiety, that would have adverse effect on their breathing pattern. So when I started this program at Jupiter Hospital, the patients would come, and I started realizing that those patients who used to frequently come to me with a lot of stress and a lot of issues, when they joined this program, they enrolled for this program, slowly and steadily, their symptoms started to reduce, their oxygen levels started to improve, and the disease, what for which they were coming to me, that also started to get better. So there were no structural changes happening in there. So if I did the CT scans or if I did the lung function test, I wouldn't see a great difference. But the symptoms were much more better. Their activity levels improved. And person used to repeatedly come to my OPDs with symptoms. They started coming more frequently to my classes. And that was a real happy moment for me.
Yeah, I'm sure. And then about anxiety, and is it kind of saving of your energy when you start doing breathing exercises? I mean, does it help rejuvenate, and does it help us to collect our energy and do more, to be more efficient? I mean, just sort of curiosity, I was asking you.
Yeah, so this is a very beautiful concept, and that is a core fundamental of HealthBank. As I was telling you, when you talk of bank, and see everybody understands language of money. Talk of money, and that example also, it goes straight inside, and people don't forget.
So that's why
I mean,
that's why you named it as Health Bank.
absolutely yes, yes. So, say when you talk of money, what is the first and the most important thing is that you to earn money. You
Earn
need
money.
good
Yes.
amount of money. But I
Yes.
see people who earn a lot of money, but they spend also a lot of money. So if you earn a lot of money and you spend it all, then ultimately you're not left with much. So it's important to earn a lot of money. The second component is saving. So you must know how do you save money. Okay. And then whatever is left behind after saving is that you must know how to wisely invest it.
Invest it.
To invest in such a way that over a period of time, your money starts working for you, you enjoy your wealth, and then
Yes.
you don't have to work for money. So these four components, that is earn, save,
Save.
invest, and enjoy. So that is what is so very crucial. Same thing is true. In fact, it is more true for our energy reservoir. All of us have limited energy reservoir, but it's possible to increase the reservoir. So most important thing is you increase it by earning more prana or more energy. So all
Okay.
types of breathing exercise, Kriya Yoga, and different things or different type of breathing processes you can learn and actually take in more energy. So that's the first component. The second component is saving. So you must understand that where is the expenditure? Where do you spend
Mm,
maximum amount of energy? And
okay.
it's found that the maximum amount of energy is being spent in your thinking, in your thoughts. In a day, a typical average person thinks about 60 to 80,000 thoughts. And out of these, 90% thoughts are non-productive or counterproductive, and they drain your energy.
Absolutely.
So with meditation, if you can work on actually draining out all this negative thoughts, then you save a lot of energy. So you earn more, then you save. So
Yes.
you earn through pranayam, breathing and kriya. You save through meditation, so you have more reservoir. And then there are processes, say for example Kriya Yoga, where you are taught how to invest this energy into deep penetration into your deeper being. And that's where a lot of stored garbage can be removed. And by doing these practices regularly, you create such a big energy reservoir that you enjoy this reservoir. Then, even if you don't do once in a while your regular practices, you have that energy reservoir or reservoir of prana, which will help you in anything. It may be, in your career, in earning money, managing your family, or looking healthy and fit, or just, enjoying your spiritual sadhana. Anything that you want to do, this reservoir will help.
Yes. Beautiful, beautiful. So, I would want to know what is Prana Shakti. I've heard so much about Prana Shakti. I've heard about Kriya Yoga, but I still am not very well versed with these concepts. I would want to understand this and get a bit of more clarity about it.
Okay. So, this energy is something which is not very visible or tangible, but that's to be experienced. Something that we see, like a physical body, we see, sun you see, or moon see, nature you see. Nobody has to convince you about it because you can see it with your eyes.
Yes.
Energy is something which is to be experienced. Yes, after being advanced into this practice, you can actually see the aura, the energy, energy circle around your body. That is actually your energy body. That's at a later stage. But for a common man, how do you understand about this energy? Uh,
Mm,
so just to give you an example, like we use a lot of electrical appliances, say tube light or fan or refrigerator or whatever different. So you see the output and use it in a different way. But what runs these appliances is common, and that is the electricity.
electricity.
That is something which you don't see, but you see the appliances. Like we see different form, myself, you, he, she, or different forms you see in different kind of energy level, but whatever is sticking behind is that force or that energy. That is what is the pranic energy. That's so depending on what is the level of pranic energy that you have, so your energy, your strength, or your magnetism, all that is depend on that force. Okay. So that is what is like the electricity which runs the appliances. This energy is what runs the form, and that is more to be experienced. So how do we experience that? So when you do any breathing exercises, or when you do kriya practices, or when you do pranic exercises, suddenly feel that your energy levels are high. You start to feel very happy from inside. And when you are doing this breathing exercises, like when we teach our students, we ask them to experience what are the expressions of this pranic shakti, that you start to feel tingling around your head, or you start to feel tingling around the tips of your fingers, around the nose, around the ears. These are all the energy points where you start to feel the vibration. And that is what is the feeling of. In people who practice over a period of time, you start to see that their complexion changes, their charisma starts to improve, and they start to look more vibrant. That is the expression of prana shakti.
Okay. How about Kriya Yoga, and how does Kriya Yoga help in this entire process? Like you were just explaining about focusing on the breath, that entire process is Kriya Yoga, or is it a more higher and a spiritual process in the later stage? And while you were talking about something that is not seen and something that is seen, I could relate to our scriptures where they've said that guna and nirguna, like what you see and what you don't see. So that was, I was really relating to that concept.
Yes,
Yeah.
yes,
So
yes.
yeah, please.
Yes, yes. So thanks for that question. It's a very relevant question. And see, there has been so much of secrecy created around Kriya Yoga, but
Mhm.
it has been mentioned in Bhagavad Gita.
Yeah.
Kriya Yoga has also been mentioned by the father of yoga,
Yoga.
Vishnu Patanjali.
Yes.
And earlier times we said that people who used to do years of tapas or years of sadhana, used to live in Himalayas, and very advanced yogis used to kind of be given this diksha about Kriya Yoga.
Yeah.
But the father figure or our Moksha Guru, Pujya Shri Mahavatar Babaji, who has given this Kriya Yoga to the mankind. Many of you may have read the book Autobiography of
Biography of
Yogi.
a yogi.
That uh, the master has mentioned about Paramahansa Yogananda has mentioned about Babaji's and how the Kriya Yoga came to the mankind. So, what was the main purpose of Param Pujya Shri Mahavatar Babaji? That he wanted this Kriya Yoga to be practiced by a common man. A householder spirituality was
Okay.
something that he wanted to focus.
Okay.
So
Okay.
he wanted to give a path which was so powerful, so magical, and yet very spiritual and fast walking. So it's like it's been described that like from here to Delhi you want to go, you can go, you can fly off, and that's the fastest route that one would want to take. And this is how to progress in your spiritual path or to progress in your material world also. This is a path to be taken, which is kind of fastest acting path. And that's how the knowledge of Kriya Yoga was given to
Mm.
the mankind. And first it was mentioned, given to Lahari Mashai. He was himself a householder.
Okay.
And
Okay.
it's so relevant for today's time.
Yes.
For today's man, the biggest challenge is finding a time.
Fine.
So you want to, you want to go and work, you want to earn your livelihood, you want to manage your family, to take care of your responsibilities, and yet you want to spend time on your health and spiritual progress. So where does a man find time to do all these things together? Okay.
Mhm. Mhm.
And so in today's time, I would like to share a little story about how this Kriya Yoga came to my master. So my master, we call him Guruji Prem Nirmal and his wife Bharati Nirmal. So in 2000, year 2000, Mahavatar Babaji appeared to my master, Guruji Prem Nirmal, and he was initiated into Kriya Yoga. Now, till then, Kriya Yoga's knowledge was kept very secretive, and it was to be given to very ardent students who would be walking on this path for some time. And Guruji, for the first time, was given permission to write down systematically about Kriya Yoga. He himself is an engineer and a very scientific person. So he invented this entire process into such a practical process, which without losing the essence of it, without using the highest spiritual significance of it, he created a very practical process. And till date, I think more than 40,000 people have been initiated into this process. And that's, I told you that in a very fast and magical way it starts to work for a practitioner who is willing to surrender, get initiated, and practice it regularly. Okay?
Okay. Interesting. Uh,
So you would also want to know about the actual process.
yes, yes, yes.
Yeah. So having said this background, now actually how does this process work? And Rashmi, I would tell you that you created a beautiful background by asking such relevant questions that it is very easy for me to explain that how the whole thing would work. So we talked about breath, we talked about prana, and now we enter into the third dimension, which is the main thing about Kriya Yoga. And the most important thing about Kriya Yoga is that it has always been passed from master disciple, master disciple.
Okay.
Most
Okay.
important thing is the most important thing is to be initiated formally by the master. Okay.
Okay.
People can see YouTube or people can see some read some literature and start practicing about it, but it's to be formally initiated by the master. So a lot of significance about being initiated, surrender, gratitude, and then receiving this knowledge. Technically speaking, so we talked about breath and prana. So it starts with breath. The most important thing, or the most initial thing, is to start with the breath at gross level.
Mm-hmm.
Your breath, you take your breath in such a way that you take maximum amount of energy with each breath. So the first thing is breath correction
Mm-hmm.
in a particular rhythm. It is prescribed as 3:2 rhythm. So inhale for 3 counts and exhale for 2 counts. And then with the right kind of breathing,
Mm.
next level opens up, and that's your prana shakti increases.
Okay.
So your pranic reservoir increases. And then Kriya Yoga is a process where systematically you take sequential breath in a manner that you allow this prana shakti to penetrate from the lower to the higher chakra. So from the lower, that's the first chakra, to the highest chakra, seventh chakra. And the third, the most important aspect is getting into the process of meditation. So once this penetration happens, then you get you get connected to the cosmic energy and your consciousness. So you access into your consciousness through the meditation. So it's a path which starts through breath, goes to prana, and ends with getting access to your consciousness.
Conscious.
From that's where all your accumulated negative emotions, whatever negativities and the garbage that you've collected slowly and steadily, that starts to get cleared and your consciousness starts to expand.
Yeah, great, great. I'm sure it's a bit addictive also when you get used to doing this. You would want to do it, very often, and you would want to be consistent in practicing the breathing exercises.
Absolutely. I mean, as I was telling you, there were so many transformation stories that I've had, and one
Yes,
particular story I'm always happy sharing about.
yes.
A person, a patient was referred to me. He was a smoker. He was a heavy smoker,
Okay,
50-year-old, and he had undergone angioplasty twice, and
okay,
still he could not stop smoking. And then he had to undergo CABG or bypass surgery,
okay.
because he had third attack. And that's where the cardiologist was really fed up, and he said, I don't have patience to deal with this man. Please help him with quitting smoking. He's not even considering now. So when I met him, and I tried to counsel him, and so he was not very receptive to whatever I was trying to. So whatever I was talking was not
Absolutely,
inside.
yes.
And then I found out that this man had interest in meditation. Many years back, he had done some transcendental meditation.
Okay,
I
okay.
got that thread, and I told him, why don't you
Mm,
our meditation classes in the hospital? At Jupiter Hospital, we've been conducting meditation classes for past 12 years now.
okay.
Joined, and somehow he felt very happy. And then he joined our HealthBank. He started to learn few sessions,
Mm,
met my masters, and there he really connected with him. He got initiated into Kriya Yoga. He learned Kriya Yoga.
okay.
And smoking, of course, was dropped out, but that was a very small benefit. This man was completely transformed. Now he's still into learning for past 5 years. With
Okay.
family came his wife, his daughter, his sister. So this one man smoking connected him to the path of Kriya Yoga, and that became a transformation journey, not only for himself, but his entire family.
Family,
So,
yes.
I mean, the joy and the satisfaction that I would
Yes.
this, I mean, is unparalleled. I could never get this kind of satisfaction with just my
Like,
medication practice.
yeah, yeah, I'm sure. This was a lovely discussion, and I thoroughly enjoyed. And I'm sure our viewers would have also learned quite a lot from it. Where is Jupiter Hospital? Would you like to share that?
Yeah, so Jupiter is a multi-specialty hospital. This is in city of Thane.
Okay.
It's a 350 bedded hospital. And
Okay.
in that hospital, our department is Department of Pulmonary Medicine.
Okay.
That's where I head the department.
Okay, great. And if somebody doesn't have any, heart issue, pulmonary issue, and they have something else, so would they be still welcome to the meditation center and those classes also?
Yes. So yeah, anybody. I mean, in fact, the sooner you start, the healthier you are. You start, land up with all those issues, and that was his main purpose of HealthBank.
Yes, yes,
Currently, because of the COVID pandemic,
yeah.
the offline classes at Jupiter Hospital they have not been running. But
Okay,
we at HealthBank have been conducting a lot of online classes, online courses. That was also an adaptation which we had to do because the offline classes.
Corona, yes.
And in last 2 years, we've had a lot of opportunity and a lot of work has happened in guiding people, connecting people into various kind of breathing exercises. Some of those exercises you have also experienced.
Yes, I have experienced it.
And
I've enrolled into Health Bank. I've done the 3 sessions, so I will be soon be enrolling for the regular sessions as well.
yes, so this is what online it is going on. It's very much available, and this the beauty of this Kriya Yoga is that see many of my patients who are currently joining me for the online classes. There's for formal yogas. Many elderly patients who have arthritis or back issue, they cannot do the asanas, so they kind of feel that oh, yoga is not for me. But Kriya Yoga is such a beautiful process that even a very sick, so the sick person or person with a lot of age-related issues also can sit and do the breathing exercise or stand and do the breathing exercise and doing Kriya in sitting position. They actually, people, elderly people or people who are having so many health issues are also able to practice this process and enjoy lots of benefit, and that's the beauty of this path. So people of different age group, people with different disease condition, people with different social and educational status also can learn this process and move in their own way.
Great. And I think so it's still beneficial because it's online, so it's accessible anytime. So
Absolutely.
I would urge my viewers to really go and, I'll be sharing the link in the description, sharing some the link so that you can go and register. So this was amazing today. Today being a Sunday, this is the best way I could, spend time talking to you. And it is an investment. It's not a spending, spending
Absolutely.
time.
Now you're talking the language of health bank. It is an investment, yes.
Yes, thank you so much. It was a pleasure having you on my show.
Yes. Thank you, Rashmi, and thank you, all the viewers. Bye.
Thank you. Bye bye.